I'm clicking record now. So we are going to go ahead, since it's a small group, and allow you to stay unmuted if you would like, if you don't have a lot of background noise, so that you can ask questions. But my job, I am Nancy McPhee, and I am the vice chair of the Society for Ethical Ecotourism in Florida. And we're an organization that's a nonprofit that's been in existence probably for 15 years. We started here in Southwest Florida, where Rachel and I are located, and have now expanded statewide. And we have board members in every region of the state. So, of course, our mission is to encourage interest and support in Florida's ecotour providers and their clients by encouraging them to sustainably explore and enjoy Florida's unique natural and cultural heritage. So one of the main things we do is provide educational opportunities. And so in part with a grant from Visit Florida, we are able to present the ecotour webinar series again this year. We usually do it between the months of April. We started in May. I think we started in May this year and through October, when our ecotour providers are not quite as busy and they can join us for educational sessions. Many of our ecotour providers are encouraged and are interested in pursuing certification through Florida Sea, and that is a big part of what we do. You're basically provided a list of guidelines, and you kind of do a self-check and improve your operation so that you can become certified by Florida Sea and benefit from our marketing efforts. We are an all-volunteer organization, so we're still growing and trying to do a good job to market our ecotour providers. So tonight, we're very lucky to have CROW, which is the Clinic for Rehabilitation of Wildlife, present for us. Rachel Rainboat is our presenter. She's the Development and Education Coordinator at CROW, and I've known her, I think, since she was an intern at CROW. CROW has been around for a very long time, but it is not. It once was not what it is now, and I credit Rachel for that. It is a wildlife hospital, and she'll tell you all about that, but before she started, there was not as much outreach for the public, and this is really happening in a grand level now, thanks to Rachel. And she pursued certification for CROW through Florida Sea last year, so we're happy to have CROW as a gold certified member of Florida Sea. So I thought, who better than to present on this topic, wildlife rescue. When I was a parks employee for many years, we often had CROW teach our frontline park staff what to do if you come across a cormorant or a anahinga with fishing line wrapped around it. And they've been doing this for years. I think this is the first time we've had them do a webinar for us. So we're glad that you're joining us. And I'm going to turn it over to Rachel. I see we have Bruce, Jennifer, Suzanne, and Megan with us tonight. Rachel, and unless you want them to introduce themselves, I think just to find out where people are, I'm going to turn it over and let you run the show from this point forward. Okay.
Sure. So, absolutely. Again, my name is Rachel. I work at CROW. I started off as a volunteer, and then I was an intern at the hospital for 6 months as a fellow, a student fellow. And then 2 weeks after my term completed, I was brought on to staff. So I have been trying to do as much as I can by promoting community partnerships with facilities and agencies like Florida Sea. So I'm also really excited to be here tonight. But yeah, if because we don't have, an overly large attendance tonight, if everyone wouldn't mind taking a moment and just introducing themselves and saying where we are, that way I can't necessarily put a name to a face, but we'll get a little bit more familiar with our group.
So let's start with Jennifer. Jen, why don't you tell the crowd what you told us?
Well, I work at Bush Wildlife Sanctuary in Jupiter, Florida. I'm a zookeeper, and for our permanent residents, we have a few animals that can't be released back into the wild, so they live with us for the rest of their lives. And then we also have a wildlife hospital, and unfortunately, my hospital director can't make it tonight, but so we're just curious what information is going to be given and if there's anything helpful to us and stuff like that.
Excellent. Okay, how about Suzanne? Suzanne, welcome. You get the prize for traveling the farthest. I'm not sure she's muted, so she may just be in listening mode. Not everybody wants to speak. So we have Suzanne, I believe she's from Michigan, and we have Bruce, and I recognize Bruce's name. Bruce, welcome.
Hi, Nancy. Can you hear me okay?
Yes.
Great. My name is Bruce Loye, and I am from Central Florida. I am a Florida Master Naturalist. I have kind of two parts to my work life. I am in corporate training and process improvement, and then I'm also a educator as well. Have a wide interest in the environment, done a lot of things, both hands-on and research-wise. My kind of main passion is fish and aquatic, but also very interested in the entire environment and all creatures. So thrilled to be here and to learn learn more about crow.
Excellent. Thank you. And we have Brian. Is Brian able to unmute or? Okay, well, we will, you're free to mute yourselves during the presentation and unmute if you have a question for Rachel as we move forward. And I'm going to turn it back over to you, Rachel.
Okay, thank you, Nancy. So a little bit about CROW before we kind of get going in our webinar. We are an organization that has been in operation for now in our current 50-year anniversary. So as with many wildlife rehabilitation facilities, it was definitely a growing endeavor. We began in 1968 out of our founder's home on Sanibel Island, and then from that first year, she took care of, with the help of her neighbors and friends, 500 animals. And now we're at a point where our medical facility admits in upwards of 4,000 or more animals a year from predominantly Lee County, Southwest Florida, but we do often get transfers from other parts of the state as well as other parts of the country. So much of the information that I will be speaking on tonight will be as it relates to Florida wildlife rehabilitation standards, but of course, because we do care for migratory animals, this information should be transposed to other parts of the country as well. And again, as Nancy mentioned, if any of you have any questions as we're going through and I'm discussing the webinar, feel free to interrupt me. Okay. Yeah. Oh, there we go. So quick CROW facts. So our hospital is open for patient care 365 days of the year. So that means regardless of what day of the week it is, what holiday or what religious observance is going on, we're definitely here for our patients. And at our facility, we are lucky to have a paid staff as well as a very active student and volunteer base to help provide aid to our recovering patients. Last year, we did care for, I think it was 4,200 and some odd animals that were admitted to our facility, and that did make up an upwards of 150 or more different species. This is our wildlife hospital. We are located on a 12.5-acre campus on Sanibel Island, but although we are physically located on the island, the bulk of what we care for comes from the mainland. So with that in mind, if you are an eco-tour provider or a naturalist, we are coastal, but we also get a lot of our animals from inland areas as well. So I will try to discuss animals that you would find while going on trails, as well as animals that you would also encounter on a marine vessel as well. So with our annual caseload, because we do treat migratory animals, the bulk of what we're going to care for at our facility is going to be avians or birds. So about 60% of our annual caseload is birds, approximately 30% is going to be mammals, and the remaining 10% is going to be a combination of reptiles and amphibians. To give you a little bit of a brief history on sort of the timeline and development of wildlife rehabilitation within the United States. It's definitely a growing endeavor, just like our facility as well. Prior to the 1970s, there wasn't really a standardization per se of rehab. As long as you had the will and the resources and a little bit of know-how, you were able to be a what was known as backyard rehabber, where you did a lot of it out of your home and your private residence, just like our founder did as well. But as conservation became more of how do I want to phrase this? It became more of an important factor within people's lives as well as their businesses. There became a need for standardization. So really the first major, I would say, effort to go towards that next level of care was the IWRC, or the International Wildlife Rehabilitation Council, and that sort of occurred in California in 1972. And then 10 years after that, we had the National Wildlife Rehabilitation Association, which occurred out of Naperville, Illinois. And that was a combination of zoos, aquariums, colleges, and universities that met together to sort of collaborate and share information on a larger scale. And then in here within Florida, just 6 years after that, developed the Florida Wildlife Rehabbers Association. So in conjunction, all of those three entities work very closely to make sure that the group, whether you are a medical professional, an environmental enthusiast, or a licensed or certified rehabber, can come together and stay up to date on the most contemporary treatment methods for these animals. So, but most of us, I'm assuming, are Ecotour providers who deal with programming on a regular basis. So, what does this all mean? Why would it necessarily matter if we are taking care of things like pelicans and possums and rabbits and snakes? How does wildlife rehabilitation really relate and translate on a positive note to the ecotourism industry? Well, Florida, as are many other beautiful spots across the United States, it is a tourist destination, and a lot of our bread and butter comes from the tourism and hospitality industry, particularly the newest and fastest growing aspect of that, Nancy, correct me if I'm wrong, being ecotourism.
Absolutely.
So for us, it's in many ways we have to compete with many other destinations, and how do we do that but by enriching the natural resources which we have been blessed with. So information that every 10 years or so, there is a census and a study done by the U.S. Fish and Wildlife Services about people who engage in fishing, hunting, and other wildlife recreation activities. And in 2011, which was the last one, you can see that 6.4 million U.S. residents participated in Florida wildlife-related recreational activities, and the most of which were wildlife watchers. So by facilities such as CROW caring for these animals and trying to get them back out into the wild, we are providing a good commodity or service that is invaluable to the state. And $9 billion were in expenditures were produced as a result of these wildlife-related recreational activities. And the bulk of that is trips. So that's going to be dolphin tours, shelling, guided trails and walks, and all sorts of different excursions that people, they come here wanting to see wildlife. So definitely, if you happen to see an animal, it would be in your best interest as an ecotour provider or an environmental enthusiast to, if you are able to, assist this animal. Similarly, ecotourism in general is a huge commodity taken from the Florida Department of Economic Opportunity. Wildlife viewing in Florida in 2006 had a total economic benefit of about $5.2 billion. And ecotourism in that year created over 51,000 jobs, as many as Disney. So again, we're competing with some of the quote unquote big dogs now in terms of conservation and ethical ecotourism. Some general information. So with rehabilitation facilities such as CROW that are licensed in the state of Florida, we operate under many statutes, including Florida Fish and Wildlife, as well as U.S. Fish and Wildlife. And prior to 1995, January 1st of 95, you didn't necessarily need permitting to care for animals to help them out. But as of January 1st of 95, anybody who does not have a wildlife rehabilitator's permit must obtain one in order to provide any sort of medical or supportive care to wildlife. And within the wildlife rehabilitation permitting, you can either be a licensed wildlife rehabilitator or you can be a certified one. So licensed rehabilitators are going to be individuals or facilities that have caging, housing, and medical professionals that are dedicated toward the care of these animals. Whereas a certified rehabber has obtained the knowledge base to care for the animals, but they work under someone else's licensure. And are we good on questions so far? I think so. Okay.
Yes, we just had Monica join us, and Pete Cordino is logging in. So, good job, Rachel.
Okay, so if you happen to find a wild animal, so you're out on a tour, kayaking, a boat ride, or you're in a trail, if you find a wild animal, you know, what do you do? So many of us obviously value nature and Florida's natural resources, which is, you know, why we've registered for this webinar. But you may or may not know, if you see an animal that's potentially in distress, how to proceed. So the first thing that happens is what we call the initial incident, where you see an animal that we consider ADR, or ain't doing right, whether it has a tilted head, a droopy wing, or if it was hit by a car, and how do you help it? Well, the first thing that we'd try to help you figure out is, you know, when do you actually rescue an animal and when do you leave it alone? Because at times animals do exhibit certain postures, vocalizations, or mannerisms that might be a normal part of their daily lives, or it might indicate that they're, you know, potentially injured or sick in some way. So the first thing that you would want to do is contact a local licensed wildlife rehabilitator to help you go through that initial wildlife rescue assessment. And at the end of this webinar, either later tonight or for tomorrow morning, I have included a PDF list of all of the licensed wildlife rehabilitators located in the state of Florida. So everyone who's registered for the webinar will have that information accessible to you afterward. Now at CROW, we're lucky that we have at our licensed facility something called a first responder, or in many ways like a 911 operator that is trained to deal with wildlife related emergencies. And so they sort of walk you through that step-by-step process over the telephone within a few minutes to figure out if the animal needs help or if it's best to leave it alone. With wildlife rehabilitators, I know that I'm probably not the only one that feels this way. At times you'll get contacted regarding an animal that might be just a potentially nuisance animal. And because rehabilitators provide medical care, they're not a nuisance removal service. So they wouldn't just come and get a raccoon out of your trash can just because it is there. And through definitions via FWC's website, a nuisance wild animal would be one that is causing or is about to cause property damage, presents a threat to public safety, whether that is, you know, physically or emotionally, or causes an annoyance within or upon a building. So if we have determined with you that it is a nuisance wild animal, then your best course of action would be to contact a licensed trapping service. And again, I didn't attach those with the webinar, but you can find all of that information on FWC's website. And I do want to preface, sorry,
we get calls about that all the time. I just wanted to point that out.
And honestly, because I think all of us except for Suzanne is from Florida, a lot of the nuisance wildlife cases that we end up dealing with are because people have a very bad habit of feeding wildlife. And as a eco-tour provider ourselves, as well as being wildlife rehabilitators, we always emphasize to the public that if you love wildlife, if you genuinely care about them, please refrain from feeding them, because wildlife then develop the impression that people are going to be a readily available food source. And that can be as mild as getting attacked by seagulls at the beach when you're trying to eat lunch, all the way to, you know, heaven forbid, someone becoming bitten or attacked by something the size of a 13 to 15 foot alligator. So definitely when wildlife are not negatively impacted by people in that way, when they aren't fed, then they have no motivation to want to do anything other than what they normally would be doing in nature.
Yeah.
So common examples of nuisance calls, you know, we have raccoons, possums, or squirrels on our property. Particularly with your smaller land mammals, they are very, very opportunistic. Some animals, like our raccoons and our possums, are known to migrate, you know, between 5 and 10 miles a day looking for food. So if wild animals have a readily available food source, either via a bird feeder or leftover cat food or scraps, they're going to remain in that area. So a lot of nuisance wildlife can be prevented by removing said food source to them. Also, I know that this is happening to me this time of the year, particularly when I'm trying to let my dog out to go to the bathroom. We're getting birds that are dive bombing my dog as I'm trying to, you know, just have him do his business. So the other thing to take into consideration is look at different times of the year. Right now, we tend to be in breeding season. So birds in particular are very territorial. They're very protective of their young, and even something like a domestic cat or a domestic dog poses an emotional threat to them and their young. So, you know, for the next couple of months, I just have to change the route in which I'm walking my dog to go to the bathroom. So again, paying attention to normal life cycles with wildlife can help prevent negative human interactions. Then we get into orphaned versus abducted, because it is baby season. I know, at least myself personally, although I work at a conservation facility, I was always told growing up that if you find a baby animal and you touch it, that mom and dad, the parent animals, would smell people on it and refuse to care for it anymore. And I hate to break the news to you, but that is untrue. A lot of our understanding about wildlife for many generations has really been based off of old wives' tales and superstitions. So another aspect of my job is educating the people on how to have healthy, sustainable relationships with wildlife. And Crow actually did a study with renesting birds that started in January of 2012 and is still continuing, on what would happen if people would touch babies and put them back in the nest, or, as you see in the picture, construct a temporary nest that the mom and dad can use until the birds are flighted. Well, since 2012, the community has actually helped Crow renest more than 2,500 babies, and we've had about a 95% success rate of the parents coming back and taking care of the young post-human intervention, even if it is not the original nest.
That's really great.
Because again, wildlife parents, in nature, there are different family dynamics, just like we have different family dynamics socially as humans. So when you have parenting with birds, typically both the mother and the father are actively caring for the young. So for example, if something does happen to one of the parents, the other one will try to the best of their ability to compensate and care for the young. Now, granted, you might have a lower survivability rate of some of your young within the nest, but you at least have an active parent's role with that nest and those fledglings or hatchlings, depending on how far along in their development they are. When you have mammals like your otters, your skunks, your raccoons, your bobcats, typically it tends to be just the mother's role. with some of the adult males, you might run the risk of paternal aggression towards the young, especially if they view that there's any source of competition for resources. So again, it tends to be just the mother's job. And if you've determined that something has happened to the mother, that that baby would need to go to a licensed wildlife rehabber for longer term care. And then finally, with your reptiles, your snakes, your turtles, your tortoises, and your lizards, they, for the most part, provide no parental care. So once the eggs are deposited and they're covered, the babies are on their own. One of the exceptions to that rule are going to be your crocodilians, so your alligators and your crocodiles. The mothers are very aggressive, and we are currently in alligator nesting season as well, and alligator breeding season. So if you happen to hear during dawn and dusk any low grumbling noises, any low-throated vocalizations, that is an indicator that you do have potentially a breeding pair or a male in your area. So definitely take precautions if you are doing any kayaking trips or boating trips or any trail hikes if you know that there are active alligator nests in the area. Is it a baby or is it or not? So for birds, it's once they have surpassed their hatching phase where they are now starting to develop flight feathers, they go through a fledging period where they launch themselves from the trees, they hold out their wings, and they hope for the best that they fly. Sometimes they are successful and sometimes they are not. For fledglings, you can pick them up and put them back in the nest. You can even leave them on the ground, but at that point you run the risk of ground predators such as feral cats, coyotes, or other predators from getting a hold of the babies. With mammals, once they reach a size where their eyes are open, their ears are fully formed, and they can move around, for the most part, the mothers don't provide a whole lot of care. Their care goes from being really in-depth to more supplemental, because they are trying to teach their babies how to forage and find resources for themselves. So if we have consulted a licensed wildlife rehabber, if we've determined that the animal in question you have found is not a nuisance animal, or it is not a baby that needs to be put back into the nest, the next step would be to proceed with caution and to obtain the appropriate handling gear. Now, what's nice about wildlife rescue is you don't have to spend necessarily a whole lot of money per se on handling gear. Some of the best pieces of equipment within the wildlife rescue community are going to be, not think linens, but thick linens, towels, or sheets, protective eyewear and gloves, and an appropriate sized container. Featured in the photo, we do have plastic dog and cat crates, but I know in the trunk of my car at all times, just as good as a flattened cardboard box with some holes in it. So the idea is you just don't want a potentially injured or sick wild animal roaming around your vehicle as you're trying to get it help. So as long as it is contained with the appropriate ventilation in the container, that should be adequate. With gloves, you can do some wrist length gardening gloves made out of any type of cowhide or leather. Your protective eyewear, if you already wear glasses, that should be adequate. But if you don't, you can get some pretty inexpensive chemistry glasses or reading glasses, just so if an animal does get free from your handling and restraint method, if it goes for your eyes are going to be protected. Then we get into your keys. So there are really 4 keys to wildlife rescue assessment. The first of which being assessing the animal's overall behavior and whether or not there are any obvious injuries. The next thing within that initial assessment is going to be to predict possible escape routes. So you don't want to potentially put yourself in danger, but you also want to limit the possibility that the animal will inevitably end up escaping you. For us, particularly with birds, it is a qualifier that if the bird is capable of flying despite the condition or the injury of the animal, they do become very difficult to rescue. So at times, many rehabilitators do end up having to wait until the animal is debilitated enough before it can be contained. And is the animal in immediate danger? Can you put it on the side of the road? Can you get it out of the water? Can you prevent it from you know, having an immediate or near death situation by getting it into a safer region? The next thing would be to avoid injury to yourself as the rescuer. That could be a physical injury, which is again why we have that handling gear, or the potential for zoonotic diseases. So for those of you who are not necessarily familiar, zoonotic diseases are diseases that are transmissible from animals to people. That could be something like salmonella, all the way up to something like rabies within a rabid mammal. So again, I'll go through this a little bit later, but certain diseases, just doing your research and consulting a rehabber to see, is this an animal that you could rescue or restrain, or would it be something better suited for one of their staff or volunteers? Then we're going to want to avoid injury to the animal. So again, the towels and linens help to quickly subdue the animal and prevent secondary issues like other lacerations or cuts. And then using species appropriate restraint techniques, which again, we will cover here shortly. And then finally, reducing the stress of animal during capture. It is going to be a little bit of time before you are able to get it to a licensed wildlife rehabber. If you are out on a boat or if you're out on a trail, just making sure that that animal is isolated in a quiet space where it's not going to be overly stressed out. Because sometimes animals can potentially stress them out and cause, you know, premature death, or if they get really lethargic or clinically tired. So stress reduction is definitely super important once the animal has already been contained. So now we have the animal, we have determined that the animal needs help. We have determined that you have the appropriate gear and you have assessed the situation. Now we're going to think about you know, animals' adaptations. So because in order to survive, animals do have to adapt. So there are going to be two different types of adaptations that you will want to pay attention to when potentially going about a wildlife rescue and transportation. The first adaptation would be a physical adaptation. These are going to be things on an animal's body that help them to survive. Things like predatory birds such as eagles, hawks, falcons, and owls, they have the presence of talons, as well as quite a bit of grip strength, and their curved beak. Those are potentially hazardous. Similarly with your crocodilians, so your alligators and your crocs, they have rows of teeth, they have very powerful tails. Again, a lot of potential for physical harm. So again, paying attention to the physical aspects of your animal will help keep you safe. Behavioral adaptations, on the other hand, are a little bit trickier. So again, knowing that fledgling birds launch themselves from the tree, knowing that something like some of our shorebirds, they feign being hurt or injured to draw attention from predators away from their nestlings at the beach. So knowing some of the behavioral quirks as a pause, rewind, play. As a master naturalist, for example, would be helpful in the rescue and restraint of these animals. So now we are at the point where we are going to cover the wildlife handling tips. And again, I'll cover it in order of what we would treat or see most of to what we would see the least of. First of which is going to be avians. And for those of you who have joined us a little bit later in our webinar, at our facility, about 60% of the caseload that we care for in a year are birds. So we will cover birds first. When you capture birds, for the most part, the general rule of thumb is going to be to control the head. The head in most situations is going to be the most dangerous part of the animal. So as with any wildlife handling and rescue situation, control the most dangerous part of the animal first and let go of that last. For birds in particular, the next thing you're going to want to do is to fold the wings against the body the way a bird would naturally hang as if they were sitting or perching on a structure. With birds in particular, they do have predominantly hollow skeletal structures. This aids in their ability to fly for long periods of time. Well, with that in mind, bird bones are also fairly delicate. So if you are getting a hold of a bird and you potentially move the wing in a certain position, you might accidentally break something. So again, the quicker that you can control the animal and fold the wings against the body and tuck the feet, the better, the less likely chance you are going to cause a secondary issue. Then you're going to want to put it into an appropriately sized box. So again, cardboard boxes work great. You do not have to spend a whole lot of money on super expensive caging. It is important to try and have, if you can, size appropriate boxes, because with birds in particular, if you put them in a box that is too small for them, you run the risk of feather damage. And for some birds, it can take months for new feathers to grow in. And in some, I don't know if, I know at least at our facility, if feathers become damaged, we have the ability to imp or use donor feathers from birds who have passed away at our facility as an alternative for taking the length that a normal feather would grow. But I know that not necessarily all facilities have access to this. So again, if you put it in a box that's too small, you might end up breaking important flight feathers. If the box is too large, you might cause them to thrash around and get head trauma or concussions. So trying to get as close to that animal size as you can without harming them. And then again, letting go of the most dangerous parts last. With water birds, so again, wear protection gloves just like you normally do. And if you have a towel, let them have the towel. If they're biting the towel or they are clawing the towel, let them have the towel. And with water birds, because a lot of people do boat rides and beach walks, pay attention to any anatomic variation. So again, with physical adaptations, some birds who do plunge diving as a part of their feeding behaviors have physical adaptations where they actually lack external nares. So those are going to be those external nose holes. So when you are handling things such as gannets, double-crested cormorants, anhingas, frigates, and pelicans, if you are handling them, remember to put at least one, if not two digits in between the upper and lower bill of the bird's mouth as you are handling them. Because if you happen to close their mouth, you might accidentally cause them to suffocate.
Yeah, with the anhingas, they have a serrated beak. So do you have like fancy gloves that you use to do that?
We just have basic, again, cowhide gardening gloves. Okay. So for those of you who aren't necessarily familiar, anhingas do have a serrated beak that is kind of like a stingray stinger. And so if it gets caught on something, it can tear your hand if you're not wearing appropriate handling gear. So yes, Jennifer, we just use our basic cowhide gloves, and those work well for our staff and volunteers.
Okay, great. Thank you.
Do we have any other questions as of yet?
Not for me.
Okay, then we have birds of prey. So most of the time, if you have a licensed rehabber in the area, they would not necessarily recommend that the common ecotour provider necessarily handle birds of prey. Something like an adult bald eagle can have up to 1,000 pounds per square inch of pressure in just one talon. So again, the potential for harm is just really severe. And for predatory birds, as you can see from the photos, we do not just wear the wrist length gauntlets or gloves. We actually get full arm gloves just for safety purposes. With birds of prey, again, using a towel or a thick linen, we would walk up to it, throw it over the entire top of the predatory bird. We would actually also press the bird to the ground to kind of pin it in between a hard place. And from there, we would restrain the talons, which in, again, most of your bird species, the head would be the most dangerous part of it. Well, despite predatory birds having curved beaks, the talons are the most dangerous part on the bird. So once the talons are controlled, then we would, fold the wings within the body as they would as during perching or sitting, and then finally cover the face or the eye. If you have access to a hood, removing the visual stimulus of, being handled or restrained calms them down as well. So after we go through each of the handling techniques, I'm also going to talk about what situations would you encounter as an ecotour provider or a naturalist or a tour guide that you would see these animals that would need help. Again, number one, because it's nesting season, you might get tons of birds that fall from the nest. With your passerings, or the birds that are the size of your songbirds, if you want to re-nest them, if you know where the nest is, that is the best place for them. But if you cannot identify where the nest is, or if the nest has been destroyed, you can mount a temporary nest or a basket in the tree where they came from. With your songbirds, as long as they're between 10 and 20 feet in the air, that should be adequate enough for the parents. For some of your predatory birds, they would probably want to be hung up at least 25 to 30 feet in the air before they would feel as though they are at an appropriate height. So you might end up having to work with some of your community partners to make that happen. Vehicle strikes. So again, during tourist season from basically December through May, we get pretty busy down here in Florida. And the more people that we have down here, the more vehicle related trauma we see. So we definitely get quite a few owls. What is featured in the photo on the right is not any sort of viscera or damaged tissue that is actually neck brace. So we end up seeing quite a bit of birds that come in with concussions, dilated pupils, or what you can see from that photo called something called torticollis, or where it's a neck tilt. So that bandage is actually helping keep the bird's head erect so that it maintains balance and equilibrium. We also get quite a bit of monofilament line entanglement. So I am all about responsible recreation. I grew up fishing. I love fishing. However, I know as a responsible recreational angler that with monofilament line, if it is left out in the environment, it would be there over 600 years. So what I recommend is if people collect tennis ball canisters or some kind of holding device where you can put discarded fishing line or lures or hooks while you're out kayaking or on a boat ride. And that can kind of be one of your jobs of your guests that you're hosting too, is like, help us spot the fishing line so that we can remove it. The fishing line entanglements that we see is going to be a lot of nesting material. So a lot of our osprey and bald eagles utilize fishing line as nesting material. So another one of our educational initiatives that we have at Crow in partnership and collaboration with some of our other local groups is something called Clear Your Gear. So if you want to see the impacts of fishing line and how you can remove hooks from birds, particularly pelicans or gulls that like to go after your bait, there's an informational video on that website as well. Then we have embedded fishing hooks. So if you do happen to accidentally hook a bird while you are out fishing, either with a group or as an individual, the recommended best practices is to reel in the bird, all as odd as that sounds. Cover the bird's face again, appropriately restrain it, push the barb through the skin of the animal, cut the barb, and then reverse the hook out in the opposite direction. So if they happen to swallow a hook, what you would want to do is identify where the hook is and then cut the line about a foot length so that when you turn it into a wildlife rehabilitator, they can follow the line into the gastrointestinal tract, or the body, the digestive system of this bird or other animal that has swallowed it. We also see quite a bit of brevetoxicosis. So brevetoxicosis is also known as red tide poisoning. The term comes from Karenia brevis, which is that red tide algal bloom. When that is in high enough quantities in the environment in certain regions, it releases a neurotoxin that causes birds to appear disoriented at the beach. They can have anything from ataxia, or also known as head tremors, so they might look like a little bobblehead. They might be walking around in a circle as though they're very dizzy, or finally, if they have enough of that toxin in their system, they'll look lethargic or really clinically tired. So if you happen to see any disoriented birds at the beach, definitely those need to be turned into a licensed medical facility. The birds that we see most at our facility for brevetoxicosis cases are going to be brown pelicans and the bird featured in the left, the double-crested cormorants. Okay, now we are on mammal handling and restraint. So with animals like raccoons, depending on where my guests are from originally in the United States, if you typically tend to see a raccoon out during the day, it might indicate that it has some kind of a systemic disease such as rabies or distemper. Down here in Florida, we do have quite a bit of raccoons that actually become acclimated to tidal fluctuations. Because we are a peninsular state, a lot of our raccoons have adapted to eating crustaceans and other marine invertebrates during low tide. So if you happen to see a raccoon just out and passing during the daytime near the water, it doesn't necessarily mean that it's sick. Big indicators for the systemic diseases would be if they have eye discharge, nose discharge, or they look disoriented. But if you just see them out during the day, it doesn't necessarily mean that they are sick. However, with that in mind, raccoons are still known as a vector for zoonoses. So again, as a reminder, zoonoses are diseases that are transmissible from animals to people. Currently, the only way to test whether an animal in that category is rabid is by humanely euthanizing the animal and sending off samples. So definitely never approach one of those animals and try to pet them or assist them unless you have received your pre-exposure rabies vaccines, which again would be more common within medical professionals and not necessarily Ecotour providers. Other than raccoons, this would also be applicable to northern river otters, skunks, bobcats, and bats. Those would be the ones that we would see most commonly at our facility. Then we have bunnies. So we have marsh rabbits in Florida, which do like to hang near the water line. For bunny handling, again, nice quiet spaces. You will want to scruff the rabbit on the nape of the neck where there's a little bit of extra skin, and then you would want to tuck the feet. Rabbits do carry about 80% of their weight within their back legs, so by stabilizing the feet, you are preventing them from kicking. This is especially important because if rabbits kick in the wrong way as you are trying to handle them, they can actually damage their spine permanently. So if you are concerned, if you are not able to cradle the legs the way you would want to, you can always turn it into a little bunny burrito with a towel. Then the other thing to just be aware about whenever you're handling or transporting rabbits is that they do have a response called hyperthermia. So hypothermia would be when we get too cold. Hyperthermia is when rabbits essentially, as a stressor response, overheat themselves. So again, if you're housing them in a quiet space, just make sure that it is a well-ventilated area so they don't become overheated. Possums. So possums are probably, in my opinion, one of the easiest animals to appropriately, contain and restrain. And that's because their natural biology, when they're afraid or injured, is to play dead. The act of playing possum includes where they get really, really stiff, almost in a rigor mortis-like state, either when they're rolled up into a ball or they're just sprawled out. They open up their mouth and they start drooling and baring their teeth. And then finally, they start secreting a mucus from their rear end to make them smell like they're dead. So if a possum is hurt and afraid, it's for the most part just going to play dead. So it's really stiff. You just throw a towel over the top of it, you stick it into a container, and then you transport it to a rehabber. And for the most part, it's easy as that. In all the years that I've ever dealt with possums, the only possums that have actively tried to bite me were ones that had mothers that had babies in their pouches. And in Florida, we have noticed that our possums have two separate breeding seasons, one of which is in the spring and one of which would in the fall. So late summer, early fall. So we're starting to get baby possums in again. Our mammals tend to come in again, vehicle strikes. It is going to be one of the #1 reasons why an animal would be admitted to our facility. So definitely car collisions is going to be relevant to that. Now we're going to cover the last grouping of animals, which would be our reptile handling and restraint. So chelonians are going to be your turtles, your tortoises, and your terrapins. Terrapins are turtles that exist primarily and strictly in brackish water where salt and fresh water mix. So Florida has some very, very pretty terrapins called ornate diamondback terrapins, which are protected. With most of your turtle species, the safest way to handle them is going to be something called the caudal hold. The caudal is the tail or rear end area of the turtle. And quick turtle biology, the upper part of the turtle is known as the carapace, the bottom part of the shell is known as the plastron, and then the connective space between the upper and lower parts of the shell is going to be called the bridge. For individuals like gopher tortoises, it is safe to grab them from the bridge in a horizontal handling method and either assist them across the road or put them into a container. But for the animals that are featured below, like your snapping turtles, which do exist in Florida, they can reach halfway the length of their shell. Florida soft-shell turtles, on the other hand, can reach 2/3 of the length of their shell. So that's when this caudal hold would be the most applicable. So you'd want to grab them by the rear end area, get underneath their feet, and support them with 2 hands, one hand of which would be on the carapace or the upper part of the shell, and the other tucked under, which would be, again, the plastron of the shell. Something that I would not recommend you doing is grabbing something like a snapping turtle by the tail. They do have quite a bit of nerve endings and spinal nerve endings in their tails. And again, you can cause partial spinal damage if you grab the tail or yank on the tail in a wrong way. So the shell is the safest part to grab on them. In some situations, I have even seen people who didn't want to grab the turtle because they were afraid of obviously becoming bit and damaged and hurt, have used the floor mat of their vehicle in a pinch. Scooted the snapping turtle on the floor mat and dragged it across the road. That way you are assisting the turtle and you are not causing simultaneous road rash on the plastron. We tend to get in most of our turtles as a result of vehicle strikes. So the animal that is featured in this set of pictures is a gopher tortoise. They are found all over the state of Florida. Again, similar to sea turtles, it is currently nesting season for our gopher tortoises in certain areas of Florida, and we get quite a few that come in when they're trying to lay their eggs near their burrow, which sometimes happen to be close to the sides of the road. If we are able to fix the shell, we can do a combination of medical sutures or wound vac therapy, vacuum assisted closure. But as you can see beneath, this mother ended up surviving, but sometimes the mothers do not survive the trauma. And in that case, we are able to remove the eggs from the oviduct or womb and incubate them in-house, releasing the babies near where the mother was trying to lay them originally. We get quite a bit of boat strikes. So this is a very sad loggerhead sea turtle. It did come in as a result of a boat strike. For the Ecotour providers that tend to do quite a bit of boat rides, if you ever happen to see a sea turtle in this condition where there is a huge presence of what's called epibiota or barnacles and algal growth, that should be a huge indicator to you that that animal has been surfaced for a long time, because there has been enough sunlight on that shell to allow for all of that plant growth on the shell. And similarly with your epibiota, like your barnacles, a lot of them are encrusting and they can't attach themselves to the turtle unless the turtle is moving very, very slowly. So for this animal, it was probably hurt for quite some time. If you notice from our x-rays featured in the photos here, it did have exposed bone on his hand, as well as in the photo farthest to the left, there is a fracture on the skull. Unfortunately, this turtle did not end up surviving at our facility, but normally we've got, moderately good success with boat-related trauma. Then sea turtles also get exposed to brevetoxicosis. Normally you'll see sea turtles with red tide poisoning doing something called bubble butt. That's a term not coined by us, but somewhere. Where the gas exchange, the buoyancy of the turtle does become affected in a bad way, where the buoyancy of the turtle gets shifted towards the caudal end or the rear end of the turtle, to where the bottom floats up and the head floats down, and so it becomes difficult for the turtle to surface for air because they are air breathers. So if you happen to see any funny looking floating sea turtles, those probably have red tide poisoning and need to be brought into a medical facility as well. Then we also occasionally get fibropapilloma. This is a herpes type virus. It does produce tumors on both externally as well as internally. They are going to be most commonly found on green sea turtles. So if you see any sea turtles with these cancerous appearance like tumors, they also need to be brought into a medical facility. And in fact, when we get in fibropapilloma present in sea turtles, we do end up transferring them to a longer-term care facility, because before a sea turtle of this nature could be released, it does have to remain tumor-free for a year before it can be re-released back out into nature. And again, those are fibropapilloma is going to be treated at special facilities, specialized facilities that are dedicated to their care. Then we have snakes. So Florida has about 46 different species of snakes, only 6 of which are venomous. And so the likelihood of people coming into contact with venomous snakes, unless you know definitively where they live, is fairly slim. So for snakes, the safest way to grab them if they are in need of medical attention is right behind the head, right behind the jaw bones. Again, you don't want them to be able to turn around and bite you. And then once you handle the snake, a good rule of thumb is you have 1 handler per 5 feet of snake. Most of your snakes in Florida don't reach much longer than that. Some species definitely do. I've seen them, but a good general rule of thumb is 1 handler per 5 feet of snake. We get in snakes for a lot of miscellaneous trauma, glue traps, some of our more arboreal or tree climbing snakes, like our Everglades rat snake in the bottom left corner, frequently come in for swallowing foreign objects. This one came from a golf club after it swallowed a golf ball thinking it was a bird egg. We were able to provide surgical treatment, successfully remove the golf ball, and the snake made a full recovery. And then you always get the weird ones too. So featured in the bottom right is a red rat snake or a corn snake, depending on how you were taught. This one got stuck in a coconut after it went in for a lizard meal. So it was a little too robust or girthy to get out of the coconut. So we waited a couple of days, we gave it some water-based lubricant, and then slowly milked the snake out of the coconut. And it was ready to go in about 72 hours.
I have a really quick question.
Certainly.
What's the survivability of a snake on a glue trap?
We've had kind of moderate to poor survivability on a glue trap, especially depending on how long the snake has been adhered to the glue trap. If it hasn't been there as long, we have a better chance, but a lot of times by the time the finder has discovered that the snake is attached to it, it's normally, the prognosis is normally pretty poor.
Okay, I figured. I just wanted to ask. Thanks.
Yeah, for sure. Okay, then the final animal of the day is alligators. So people love coming down to Florida to see alligators. I think they're in many ways kind of one of our unofficial mascots, but with alligators, again, the potential for harm is very great. So you would always, if there is an alligator in distress, want to contact a professional. So with alligators, you have to have special licenses in order to be able to handle them or trap them, so even possess them. So again, without putting yourself in harm's way, just contact a professional if you see an alligator in distress. Similarly, if you see an alligator that you believe to be a nuisance alligator, if it gets a little bit too comfy and close to your tour group, or if you know that it's been fed by people, they do become, again, a nuisance alligator, and they become unsafe for people. So if a nuisance alligator has been determined a nuisance, you should contact the nuisance alligator hotline through Florida Fish and Wildlife. And again, that photo is at the bottom of the page. The program that kind of works with those alligators to determine whether or not they are a safety issue is SNAP, or the Statewide Nuisance Alligator Program. So they address complaints concerning alligators. And as a part of their management plan, if the alligator is determined as a nuisance, it is humanely euthanized for the safety of our guests as well as our residents. And in 2016, which were the most recent statistics that I saw on Florida Fish and Wildlife's website, about 13,000 complaints were filed, and about 8,000 of those were deemed a nuisance alligator. We tend to get in alligators mostly for vehicle collisions. With most of your cold-blooded or ectothermic animals, they're not able to metabolize food as efficiently as an endothermic or a warm-blooded animal would. So many times you see them basking in the sun or on the side of the road where it's warm so that they can break down their meals. So again, lots of our reptiles get hit by cars or miscellaneous trauma like lures or even bigger alligators. I know alligators are one of the few animals that actually actively engage in cannibalism. So once alligators are of a certain size, they'll start, if there's lack of resources, they'll start fighting each other and even eating each other. So what happens after rescue? So once you, as the finder, have obtained the animal and you have contained it, you have to transport it to a licensed wildlife rehabber within 24 hours of possession. So you, as the general public, can transport most of the wildlife species that we discussed earlier on in the presentation, excluding those that do require additional possession permits. So that would be things like bald eagles, sea turtles, alligators, dolphins, and manatees. So if you need special paperwork to even be able to have it, assume that you, as the general public, cannot transport it to a facility, and you would work in conjunction with a licensed rehabber to assist with the rescue. From there, your wildlife rehabbers will provide a combination of either medical or supportive care to get these animals back to full capacity. And again, that's when facilities such as CROW come in handy. So once animals arrive to a medical facility, many of them are provided, not many, all of them are provided with an admission exam. So during this exam, we do the initial evaluation to determine two things, the diagnosis as well as the prognosis. So in terms of the vocabulary, your diagnosis would be what is wrong with this animal? Is it sick? Is it hurt? Is it orphaned from its parents? And most of the time, if you have assisted with the rescue and transportation of the animal, that information would be provided to the rehabbers upon the transfer of the animal. The prognosis, on the other hand, would be, what is the likelihood that your rehabber is able to fix this animal? Is the prognosis good and we have a really positive outlook on this animal? Or is the prognosis poor where we don't feel as confident that we can alleviate the issues with this animal? Different rehabbers will have different access to medical care. As a licensed wildlife rehabilitator, unless you have a licensed veterinarian that is either on staff or works with you, rehabbers can only provide supportive care. So bandages, vitamins, wrappings, that sort of thing. In order to be able to provide pain management, any of your controlled substances or surgeries, that's when you would need to have a licensed veterinarian on staff, or again, working with you or volunteering with you to do that more intensive care. We also do supportive care, so if babies come in and they need around-the-clock treatments, they get fed once every couple of hours, and they get bottle fed or tube fed. They get toys to alleviate any sort of anxiety or stress from being separated from their mothers. And then we do the final course of that care, which is the rehabilitation. And once you are in the rehabilitation, that is when your rehabber staff, which function primarily in the role of a physical therapist, that they do the exercises, the test flights, the live prey training, whatever combination of things that you have accessible to your facility that gets these animals back to full capacity. Because once these animals show us that they can fly, swim, forage, do whatever they need to, that's when they get evaluated for their final re-release. When a licensed wildlife rehabber gets to the point where the animals are able to be released, they do, to the best of their ability, try to take them back as close to where they found them as possible. There are going to be certain exceptions to that rule, particularly if you see that the animal that you're working with is no longer able to fend for itself in nature. If it's clinically stable but no longer able to survive, those would get evaluated for long-term captivity in facilities such as zoos, other wildlife centers, and aquariums across the country. So that's sort of the tail end of our webinar for this evening. If you would like more information about CROW in general, you can always visit our website at crowclinic.org, or we are very active on social media. We do have a page on Facebook, Instagram, Twitter, Pinterest. I think we're on just about every platform that you can be affiliated with. So I do thank you all for signing up for this webinar. I hope you found some information, at least kernels of it, that were useful to you either as an eco-tour provider or a fellow rehabber, and that you stay in contact with us in Florida Sea if you need anything else.
Thank you, Rachel. We'll quick open up. I have a couple of messages to you. One of them from Suzanne said, "Bravo, you rescued the eagle at Pritchard Real Estate with fishing line on it." So we appreciate that. And she says, "Great presentation." So is there any other questions from the audience? You're welcome to unmute yourself if you have a question. Bruce?
Thanks, Nancy, and thank you, Rachel. That was a fantastic presentation, extremely informative. So well done. I do have a quick question. I think you mentioned one of your primary roles with CROW is related to training.
Yes.
I'm curious to know what you find to be your primary challenge, or maybe your top few challenges in the role of training with CROW.
Training in terms of volunteers or the public, or in what audience are you referring to? Because that might help me narrow down my answer a little bit.
Well, I mean, I think your top challenges could come in any of those, because, and that's part of what I'm trying to do is to understand your role and where your either could be limitations in resources, it could be target groups that you find challenges to reach. That's kind of what I'm looking for is where do you find your biggest challenges?
Okay. Well, definitely, you know, resources are going to be an important aspect in any non-for-profit organization, not just ours. So we very actively throughout the year try to solicit the assistance of volunteers. We have currently a paid staff of about 18 or 19 individuals, and that's a combination of full-time and part-time, you know, hospital staff and administrative staff, and many of us wear multiple hats, and there's definitely not enough hours in the day to be able to accomplish everything that we would like to do. So training on the aspect of training our CROW team is very important, because we want to make sure that we are soliciting for people that are able-bodied and willing to help us provide the care necessary to our patients, so that we can, you know, increase our capacity for patient care. We can increase the standard of care that the animals are getting, so that we can raise our release levels, for example. Education on the aspect of the public is important too, because as you see from the webinar, a lot of the injuries or illnesses that these animals are encountering are due to what we would consider a quote-unquote negative human interaction, which is by no means to say that people are intentionally going out and hooking pelicans or hitting turtles with their vehicles or their boats, but just definitely more on the preventable side of it. So a lot of a core group of my duties individually at the organization is to teach people how to have sustainable relationships with wildlife, and how to just, again, I know raising awareness is probably an a repetitive thing to say, but just, you know, raising awareness about not necessarily our work, but all of the animals and individuals that are out there, and just making people more conscientious eco-tour participants and visitors, as well as residents to our lovely state. And then finally, education on the standpoint of our donors and supporters. So again, promoting community partnerships so that you can kind of split up the resources a little bit, partnering with other wildlife rehabilitation facilities across the state and even across the country, partnering with agencies like Florida Sea to kind of share in these collaborative webinar sessions, and just making sure that you really get the most bang for your buck in terms of resources, for sure. So those are probably, I would say, the three most challenging things. And currently, I'm the only education staff person at CROW. So that's definitely a big job for me. So I'm always trying to get as many people as I can to assist me in that endeavor.
Thanks, Bruce. Is there any other questions from the attendees?
And again, as a reminder, probably tomorrow morning, I'm assuming, Nancy, everyone who registered for this webinar will be getting a list of all of your licensed wildlife rehabilitators in the state of Florida, as well as some pamphlets on an outline of the lecture this evening and a pamphlet on how ecotourism and wildlife-related recreational activities have benefited the United States as a whole on a dollar value and then participants. Because Florida had, I think it was like $6 billion, I think nationwide wildlife-related recreational activities did over $75 billion for the economy in 2011 in that U.S. Fish and Wildlife study. So definitely by helping out these animals, we're raising property values, we're making people want to spend money here, and we're making people more conscientious ecotour participants.
This is the piece Rachel's mentioning right here, produced by the U.S. Fish and Wildlife Service, and it's from 2016. And my regular job is working in tourism, and we get these questions a lot. You know, what is the economic value of different types of activities that tourists partake in, and wildlife watching is a big one here in Lee County. So this is a very good piece. So this is one of the things that you will receive from me in the morning. Here's the list of wildlife rehabilitators statewide. So thank you, Rachel. That's a really extra special treat that you're providing the participants of this webinar. So watch for that in the morning. I'll let more questions come, but some people might want to sign off, so I just want to mention a couple things. Our next event Florida Sea is having, we've been doing regional events around the state, is at the Brevard Zoo. So those of you, I know there's a couple of you in the north or central east part of the state. On July 29th, we will have a sneak peek and presentation on their living shoreline, which is a new piece of the zoo. It's a fantastic zoo, and we're going to meet from 3 to 5, and everybody that comes to our regional events gets a special gift, and that we partner with Visit Florida on presenting these. And as far as webinars, we've been doing them, as I said, since May, and the next one is on August 15th, and the topic is climate change, presented by Citizens Climate. So we were supposed to have them last September, but we took a break after a big storm that affected some of us, and they never got to present. So we're excited to have them back.
Welcome to visit.
So again, if you go to floridasea.org, you can see the whole list of webinars and register. So as far as the webinar tonight, I have recorded it. I know some of you joined us late. Thank you, and thank Rachel and Crow for posting that special sneak peek to the free webinar to Crow's followers on Facebook, on Instagram. It really worked. We've got a lot of you that unfortunately joined us late, so I'm going to share the webinar. Once the recording is ready, I'll make sure that everybody that was with us tonight knows where to find it. I know Jen wants to share it with her boss at the Bush Wildlife Sanctuary. We're so glad that you joined us, Jen. And so that's all I have. I want to thank you, Rachel. You did a fantastic job. If there's any other questions, go ahead and let us know right now. Otherwise, we went over a little, but it was so well done. Thank you again, Rachel.
And I know I went a little long tonight, everybody, so I do apologize for that.
No problem. We didn't lose anybody, so it's good stuff. All right. Well, thank you again. Please check us out and share with your friends what they missed. And as soon as the recording's on our page, we will let you notify all your friends so they can see it. Thanks again. Have a good night, everyone.
Thank you. You have a good night, too.
Okay, Rachel, I think I turned the recording off. I want to thank you. You did a great job.
Thanks, Nancy. Thanks for having me do it. It was a pleasure. This was my first webinar